Hi guys, I am Dr. Parvez and I am helping the international medical graduates to prepare for AMC Part 1 Australian Medical Licensing Examination Part 1. This video is regarding schizophrenia. Also, some people like to call it schizophrenia. Now, guys, schizophrenia is a very big chapter, but here we need to cover the most asked questions, most important points only. Number one, remember it is a formal thought disorder. Number two, remember that it is we have auditory hallucinations in this. In auditory hallucinations, we may have command hallucinations. They tell the patient, come up, commit suicide, and they commit suicide and they have very bad prognosis. Number third, we may have delusions. Delusions are usually very bizarre. And for example, delusion of insertion. What is delusion of insertion? They believe that somebody is putting ideas in my brain and they think that their ideas have been put by somebody from the other world, from the third world, or like that. And the second is delusion of reference. They say that TV, the people, the radio, they are directly or indirectly referring to me, referring to my ideas. Then we have thought broadcasting. Thought broadcasting is patient says, as soon as I get a thought, people steal this thought and it spreads to the world, it spreads to everybody. For example, 24-year-old patient was brought to emergency and he is holding a window in an aluminum foil and he says that windows are after my ideas. This is an example of thought broadcasting. Now we must have symptoms of schizophrenia for at least 6 months before we can diagnose a patient, before we can say that it is schizophrenia. Now we have another thing, that is loosening of association. Loosening of association means patient will say, see, my shirt is blue, sky is blue. We know that there is no association between the two, but they think in a bizarre way and they think like that. Then we have positive symptoms in schizophrenia. Positive symptoms are hallucination, delusion, and catatonia and disorganized speech. Catatonia may be, it may be, it may be we have psychomotor agitation, that is patient becomes agitated and he talks too much and he is agitated, psychomotor agitation is there. And then there is psychomotor retardation, psychomotor agitation, psychomotor retardation. Then we have negative symptoms. Negative symptoms are he is having poor speech. He has poor speech, so we don't know about his ideas. Probably he has no ideas, and probably he has poor thoughts, so he has poor speech and he has blunt affect like this. He doesn't talk, he has no ideas, he has no speech. So now we say that in schizophrenia we may have derailment of ideas. That is, they talk about something, but they talk about then one thing, then another thing, then there is no coherence, there is no sequence. And then another is word salad. Word salad is they are telling you jumble of words and they are not related to each other. For example, I may say beans, meat, track, computer, like that. And so this is a salad of words. After that, they may schizophrenic patients are most dangerous to their immediate family members. And second person they are dangerous to is the patient himself. First is family, second is himself, and third is we have the most common symptom of schizophrenia is, can you have a guess? Yeah, that is the loss of insight. Loss of insight, most common symptom. Most common cause of death, cardiovascular disease and cardiovascular disease or coronary heart disease. And Most common weather when they commit suicide, winter. It is winter. Okay, so you remember it is if so. Let's go over it quickly. Formal thought disorder, we have thought insertion, thought broadcasting, delusion of reference, we have loosening of association, positive symptoms, negative symptoms. Most common cause of death is coronary artery disease, and we have loss of insight, most common symptom, most dangerous to immediate family, second to themselves, and then we have another thing, winter weather, most common season when they commit suicide. Thank you very much. Please subscribe.